I hope you're fine. Welcome back to my channel Ateeq Dental Care English. Today we will discuss regarding a very common dental problem, that is bleeding from the gums, swollen gums and gums enlargement. What are the various causes of swelling of the gums and how can we manage it at home? So if you are new to the channel, like and subscribe the channel so that further information will be delivered to you. Gum swelling or gum bleeding is very annoying to everyone, as when we brush our teeth there will be lot of blood spots on the bristles of the teeth toothbrush, or while eating something, especially during biting of apple, there will be a red spot on the white part of the apple. So what are the various causes of swollen gums? Number one, the most common is neglect of oral hygiene, which ultimately led to increased level of bad bacteria in our mouth that attack the soft tissues of gums and produce swelling and bleeding from the gum tissue. Secondly, if you wear some removable partial denture like this one, this artificial teeth you can remove from your mouth, and they retain in the mouth with the help of these wires called as clasps. These clasps are irritating to the gum tissue and can induce swelling and bleeding from the gums. Also, if you undergone an filling between your teeth, that can also cause irritation to your gums and ultimately result in gums filling and gum bleeding. These are the common causes of gum swelling. An additional cause of gum swelling is, which is also common nowadays, is medication. Patients who are on antihypertensive medications like calcium channel blockers, the most common is amlodipine, which also result in swelling of the gum tissue. And another important aspect is the usage of toothpaste. Certain toothpaste can be irritant to your gums and can induce swelling of the gum tissue. Impaction of the food particles. Some food particles or pieces of the food can impact between your teeth and can cause swelling, infection, and bleeding from that area. The most common is eating of popcorns. A piece of popcorn can impact between your teeth and can induce swelling and bleeding from the site of impaction. A very common and social problem is cigarette smoking, especially in the males. By smoking the cigarettes, we inhale nicotine. Nicotine effect on the gums by reducing the blood supply of the gum tissue, which result in disease of the gum, as the vitality of the gum tissue will lose with the passage of time. So these are the very important and common causes of gum swelling and gum bleeding. How can we manage these problems at home? This is more important to you. The common and simple way to reduce gum swelling and gum bleeding, number one is flossing properly. Flossing between teeth properly so that any food particles trapped between your teeth can be removed easily with the help of dental floss. Second important thing is some people use extra soft brushes. The bristles or filaments of the toothbrush are very soft or extra soft. Extra soft toothbrush cannot remove the dental plaque from the teeth surface mechanically. It's not easy to remove the dental plaque from extra soft filamented toothbrush. You need some firmness or consistency of the filaments so that they can easily remove the plaque sticked on your teeth surfaces easily with the vertical motion. So always you select a toothbrush with some firmness, and the end of the filaments of the toothbrush must be smooth and rounded to avoid injury to the gum tissue. Another important thing which very few people considered during oral hygiene regime is water flossing. Water pick is a device which we can use for cleaning of the teeth and to reduce the swelling of the gum tissue. It is very easy to use the water flosser, and it will clean the gum tissue as deep as 7 millimeter, while the dental floss clean the inside of the gum tissue till 3 to 4 millimeter. Another important thing is medication. If you are hypertensive and are using amlodipine as to control your blood pressure, it's wiser to consult your physician to change this medication and use some non-calcium channel blocker medication to control your blood pressure problem. Toothpaste, which we daily use, the function of toothpaste are very limited. The main function is of toothbrush, which mechanically remove the dental plaque from the teeth surfaces. So if you want to use toothpaste, use a very little amount of toothpaste on the toothbrush, or better to avoid the toothpaste. Just simply toothbrush your teeth for 2 to 3 minutes at least. Sometimes there are hard deposits on your teeth which are called as tartar or calculus, which you cannot remove at home. In this case, you have to visit your dentist for professional scaling and polishing of the teeth. After that, after few days of scaling and polishing, your gum tissue will reverse to normal level. So this is also a very important way of reducing the gum swelling. The important thing that you can do at home is avoidance of smoking. Cigarette smoking, avoidance of chewing of nicotine tablets are also very important. So it's very good for your oral health as well as your body health to stop the smoking as early as possible. And the most important thing, the foods that are sticky and can trap in between your teeth, avoid these food, especially like I discussed in the start, is popcorn eating. Avoid a lot of popcorns, or avoid eating of the popcorns. Another important thing is some persons present with gaps between the teeth. So it's better to visit your dentist to fill that gaps with simple tooth colored fillings, or sometimes orthodontic treatment of fixed braces to close the space so that to avoid any food infection between your teeth. The latest method of gum disease which is in use internationally is laser assisted periodontal treatment of gum tissue, a very good way of disinfecting the gum tissue and reversing the problem with the help of laser. You can also discuss this with your periodontologist, which is expert in treating the gum tissue. Hopefully, this video will be informative to you. If any question related to this video, you can ask in the comment box. Thank you.